My name is Josie Roberts. I'm one of the midwives here at Adriatica, and this here is a class for OB education, just to kind of go over some of the things that you might have questions about new in your pregnancy. We're going to go over things from beginning of your care to the end of your care, different testing, different questions, different medications, things like that. In your book that you have, again, you may have the PDF file, you may have the actual book. We're going to kind of go through page by page. So first page, page 2, that's going to go over our providers. We have 5 delivering OBs here and 4 midwives. There are a few other doctors on there that don't deliver, but you may see them in the office as well. The rotation of our doctors and our midwives is important to talk about. You may get a doctor or a midwife that you really mesh with, and that's great. We want you to keep seeing those providers. But it's also a good idea to see the other providers at least once so that you can put a face and a name together. You never know who might be on call when you call with an emergency or you go into the hospital. So it's always a good idea to maybe meet all of those providers at least once. The rotation schedule for the providers, we all have a 24-hour call once a week and a Friday, Saturday, and Sunday once a month. Your midwives and your doctors, they kind of follow those same rotations. It's not the same every week. Just because your doctor may have been on call Monday that week, they're not necessarily out Monday that next week. So again, we don't really ever know until we have that week that comes up. Again, it's kind of nice to meet all of the doctors because you never know who is on call whenever you need to talk to a provider. The second page of the book is going to give you our office information. It gives you the phone numbers and the address for our offices. We're located in McKinney, and we also have an office in Prosper. Our doctors go back and forth between McKinney and Prosper, so it's not a different group of OBs at one office. It's the same OBs, just we are at the offices at different times. So whatever works best for you. You don't have to go to one solely. If one works better for you one day than another, you can go back and forth. Your information will go back and forth in our system. We deliver at Baylor McKinney here in McKinney off Lake Forest. We also will deliver at Medical City McKinney if your insurance requires. Baylor Medical Center of McKinney does delayed cord clamping for all deliveries, immediate skin to skin with your baby. They have a high-level NICU. Lactation is on staff there. They will help you with lactation after delivery. And they also offer things, if you aren't wanting an epidural, they offer things like nitrous oxide, so laughing gas, that can help you through contractions. They also have birth balls, peanut balls to help with positioning. They have great showers. Those showers can help you with the water therapy. Sometimes the warm water can help with contractions. All the nurses there have been trained in something called spinning babies, which is a class that teaches you different positions to help your babies to rotate and get in the right positions for delivery. On that third page also has ways to contact our office. There is a phone number, which is also located in the back of your book on page 11. That bolded phone number in the back will put you through to our office. During office hours, we have a dedicated nurse. Her job is to answer phone calls from our pregnant patients. She keeps in touch with your OB or your midwife if it's a question that needs to be answered that she cannot answer. After hours, it goes through our answering service. There is always a midwife and an OB on call for 24 hours. So if there is ever a medical emergency, a concern that you feel cannot wait till office hours, please call and you will be connected to one of us. On page 4, that talks about appointment schedules. So appointments in pregnancy, we see you every 4 weeks until 28 weeks, then every 2 weeks till 36 weeks, then every week until delivery. There are some cases where we may see you more if you need extra monitoring, and those cases can be things like if you have high blood pressure, diabetes, other medical things like hypothyroidism. Sometimes we do add on extra monitoring for that, but that is a case-by-case basis. So it just kind of depends on your health history, and we kind of just go from there. So, but regular no problems would just be every 4 weeks till 28 weeks, every 2 weeks till 36 weeks, and every week till delivery. We do require delivery by 42 weeks here. If you are going to go past 40 weeks, then we do require extra monitoring there as well. We would require sono and monitoring on the outside to look at baby's heartbeat for those 2 weeks till delivery. but we do want a baby by 42 weeks. That placenta is only meant to last for so long. Starts to get kind of old and calcified, doesn't want to work so well. So after 40 weeks, those monitoring that we do will really tell us to make sure that your placenta is working like it should. And again, this is a case-by-case basis. If you do have medical problems, sometimes it is required that you deliver a little bit earlier. But again, that's something you would talk to your provider about. There's also on that page of appointment schedulings, it will talk about timing of all ultrasounds. We always do an ultrasound at the beginning to verify pregnancy. You also have an ultrasound that happens between 18 and 21 weeks. That is your anatomy scan ultrasound. At that point in pregnancy, everything is developed enough where we can see all the parts of your baby we need to. The brain, the chambers of the heart, the stomach, the kidneys, the intestines. We see the fingers, the toes, all the limbs, the fluid around the baby, the placenta. All of those things are developed enough at that 18 to 21 week mark. At that point, we can also tell you your gender if you want to know. Speaking of testing and gender, at 10 weeks, there is optional testing we can do. It is a blood draw from you. It's called an NIPT test. That testing will pick up fetal cells that is in your bloodstream, and it can look for things like Down syndrome, trisomy 18, but it also can tell you the gender of your baby. Again, we can't do that till you're 10 weeks along, just because there's not enough fetal cells till then. We also can do another lab test at that same time called a carrier screening. A carrier screening looks at your blood and your genetics to see if you're a carrier for things like cystic fibrosis, muscular dystrophy, other types of blood disorders like thalassemias, different anemias. If that were to come back and show that you are a carrier for something, say like cystic fibrosis, we would then draw blood from the father of the baby and check to see if they're a carrier for the same thing. If they are not a carrier, then we just go about our business. That just means your baby could be a carrier for that disorder, but does not mean that your baby would have that disorder. Now, if you and the baby's father both have a carrier for the same thing, like both have a carrier for cystic fibrosis, then your baby would have a 25% chance of having that disorder. And this is just information that's kind of good to know. Again, it is not necessary and it's not required. It is something that is optional. We do run it through insurance. Insurance does not always cover it, so there may be a price that you have to pay out of pocket. For the NIPT testing itself, it is $249 out of pocket. With the carrier added on, that's another $100. So again, it's just kind of nice to know that you might have to pay something if your insurance doesn't cover it. And we don't want that to be a surprise for you. Along with other blood testing that we do, that being the optional one, blood tests that we do for everybody, we check your blood type. We also check for things to make sure you're rubella immune. We check HIV, syphilis, hepatitis B, hepatitis C. Those are all blood draws that we do at your first visit. State of Texas also requires we check gonorrhea and chlamydia, and we will do that on your first visit as well. If you are due for a pap smear, we will do it at that visit as well. Again, that is not something we do every time. It's just if you are due for it. The urine test that we do at that first visit as well, we do one for everybody. UTIs in pregnancy can be common, so we always check that urine that first visit. After that, every visit that you come, we have you leave a urine sample. We do not send that for culture. We do dip that urine just to look for things like protein or sugar in your urine. So I wouldn't expect a urine culture result every visit just because you're leaving a urine. I don't want you to be looking for a urine result that you might not see. If something looks suspicious, then we may send it for culture, but we would let you know that. And then that page let me go back to page 4, talking about your RH factor. So like I mentioned, we will draw your blood and look for your blood type. So that is important in pregnancy. If you are a negative blood type, we will give you a medication called Rogam, and that is something that we would give you a shot of around 28 weeks. So the reasoning for that is if your baby is a positive blood type and you being a negative blood type, there is an intermingling of blood at delivery, and your body can make antibodies against that blood type, and it could cause problems in future pregnancies. So anytime that you might have any bleeding in pregnancy and you're a negative blood type, we would possibly give you some Rogam, but we always give it at 28 weeks time, right around there, and we give it again 72 hours after delivery, just to keep from your body building those antibodies against a positive blood type. We also will offer you vaccinations in pregnancy. So around that 28-week mark, again, when we would do a Rogam shot if you needed one, we would offer you the Tdap vaccine. The Tdap vaccine, what we are wanting to give you from that is the P part, which is pertussis, also known as whooping cough. Whooping cough can make babies very sick, and they usually get it from their caregivers, moms, dads, grandparents, babysitters. When we give you that vaccine in pregnancy, your baby gets those good antibodies on board, and it will cover your baby until they are able to get their vaccine at the pediatrician's office. Again, that is not a required vaccine, it is recommended. Another recommendation for vaccine is during flu season is to get your flu vaccine. Again, pregnant women are more susceptible to illnesses, so it can help keep you from getting the flu, but also your baby gets those antibodies as well to cover baby until they are able to get flu shots. A new vaccine that has just been recommended that we start giving is the RSV vaccine. That is something that is recommended between 32 and 36 weeks. If you are due to have a baby in the fall season all the way till January. So that is also not required but recommended. RSV can make babies very sick. Sometimes those babies end up in NICU. So those antibodies really do help baby. And then let's see, the next page, page 5, that's going to talk about safe medications in pregnancy. That's what everybody wants to know about. What can I take? What can I take? So page 5, page 6, that is going to go over those safe medications. You've got everything on that list from colds, allergies, constipation, diarrhea, gas, you name it, it is there. So just to touch on a few that most people usually ask about is heartburn. That's very common. Heartburn in pregnancy, you're gonna have it, I promise, at some point. So Tums are good for, I ate some Mexican food, now I've got a really upset stomach. Throw you some Tums in there, chew them up, that'll help. But if you're having acid reflux daily, we don't want you just eating those Tums like candy. Look into something like Pepcid. That's something that's safe in pregnancy, you can take every day. So again, that's on this list here. Constipation in pregnancy, very common. The hormones of pregnancy slow down our GI system, so everything slows down, including our bowels. So making sure you're staying very hydrated. It's very important for pregnant women to get 80 to 100 ounces of water a day. That's a lot of water. So basically you're drinking water all day. That's going to help with constipation. High fiber diet. If you do all those things and you're still having a problem, it is okay for you to take Colace, which is a stool softener. And again, that's going to be on this list here. And as we're talking about hormones in pregnancy, I'm also going to touch on the fact that hormones of pregnancy make all of our mucous membranes very inflamed. Not uncommon to have a very stuffy nose, more spit, more vaginal discharge. All those things are normal. It is very safe for you to take Claritin, Zyrtec every day to kind of help with that stuffiness. Flonase works great, which is a nasal spray. It does have steroid in it, but it is localized to just your nasal passages, so very safe in pregnancy. And then also leg cramps can be very common in pregnancy, those Charlie horses in your legs. Magnesium can help with that. There's actually something out there, magnesium lotion. You can get it on Amazon, CVS. I've seen it at CVS. It is lotion with magnesium in it. I recommend rubbing it into your calves and your legs and your feet at bedtime. In fact, you can make your spouse do that. That can be their job. You get a little massage and a little magnesium lotion in there. That can help you with those Charlie horses. It's just the massage plus the magnesium together, that can help a lot. Increasing your potassium, so bananas, potatoes, those things can help as well. Again, and drinking lots of water. I'm going to say that multiple times because pregnant women do not get enough water. That uterus gets large and angry and dehydrated, and then it starts to cramp, and it's annoying, and it's a lot of times it's because dehydration. So water, 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 water all the time, lots of water. Headaches in pregnancy can be pretty common. Those hormones can cause some headaches. Tylenol is safe in pregnancy, and that is again on this list. So if you're having headaches, Tylenol, dark room, cool rag on the back of the neck. When we get concerned about headaches, if you're having a headache with blurred vision, spots before your eyes, upper abdominal pain, those things can be associated with high blood pressure. So if you notice those things and you're having a headache, please call us and let us know. We want to see you for that. All right, so next page is going to talk about nutrition in pregnancy. So the recommended weight gain in pregnancy, it differs depending on your BMI. So when you come see us for the first time, we're going to weigh you, and you can look here on this page and kind of see what the recommendation is for you. The bottom of the page kind of talks about all the different ways to get all the nutrients you need to get while you're pregnant, all the different sources there. Exercise in pregnancy. If you were doing something before pregnancy, you can continue to do that throughout pregnancy within reason. So I do have patients who do CrossFit the entire pregnancy. I have people who run miles during the whole pregnancy. If it's something your body is used to, you can continue doing it. But again, you want to make sure you're drinking lots of water. And you also want to watch as you grow, your body's going to change. The way you stand is different. You're going to be front heavy. So if you're lifting weights, doing things like that, you really want to make sure that you're paying attention to your posture and how you're standing. If you're lifting weights, you want to listen to your body. If you're lifting these weights and your body's starting to say, this is just getting too heavy, go down on weights. It's great for you to stay healthy and to continue exercising, but it's not a good idea to start a new exercise regimen after pregnancy. A lot of people think, oh gosh, now I'm pregnant, I'm going to gain all this weight, I need to go start working out. I don't want you to do that. It's not a good idea to start a new exercise program in the middle of pregnancy. What is good is walking, stretching, there's prenatal yoga, things like that. That's okay to start that in pregnancy. I just don't want you starting something crazy and new, rock climbing. No, we don't want to do that. So there's also different, again, prenatal massage, prenatal yoga, all of those things are safe, and that can help just keep you limber and keep those muscles and ligaments all ready for delivery and pregnancy. Also talking about ligaments and muscles in pregnancy, a chiropractor can be helpful in pregnancy, and that is perfectly fine and safe to do. There are prenatal chiropractors out there that do have some specialty in prenatal. It can kind of just help those joints stay loose and those ligaments stay loose, and just kind of help with comfort as well. So if you want to do a chiropractor, that's perfectly fine as well. And then page 8 is going to talk about foods in pregnancy. This is also a very common page that people have lots of questions about. The biggest things with foods in pregnancy. I know this is sad, but no raw fish. So if you like sushi, you have to just eat the cooked stuff. And cheeses, so soft cheeses, things that you would find in like the specialty cheese counters, the soft cheeses like the blue cheeses, the things that are in the regular part of the grocery store, like the mozzarellas, the cheddars, those things are okay. It's the soft cheeses that are sometimes not pasteurized, so we want you to avoid those in pregnancy. If you like shellfish, that is fine to eat, just make sure it's cooked. Calamari, fine, make sure it's cooked. Fish with mercury is what's concerning, so things like swordfish, mackerel, we want you to avoid those things. If you like tuna fish, that is fine. It's recommended that you just eat it once a week at the most. Make sure you're washing your fruits and vegetables well. Sometimes there can be pesticides on that, so just making sure that those are clean before you eat them. Caffeine is another big one. Yes, you can still have caffeine. It is just recommended 1 cup a day of coffee or 1 soda, tea, and making sure you're getting lots of water. And then deli meats, that's another one. It's recommended that you heat your deli meats. We worry about things like listeria. So putting your deli meats in the microwave or heating them up if you go to get a sandwich at a shop, will kill that bacteria if it is on there. So, and then again, specialty diets, vegetarians, vegans, it can be perfectly fine in pregnancy. You just want to make sure that you're getting a well-balanced meal and you're getting things that are rich in iron. So you want to eat those green leafy vegetables, those beans, legumes, all of those things, and just making sure you're getting all of that. And then some common questions in pregnancy will be on page 9. So those common questions that I tend to get at visits are, hey, I'm traveling. Can I get on an airplane? You can get on an airplane. Now, again, you do want to check with your provider because, again, if you have certain things going on in your pregnancy, we may not want you to travel. So I would always check with your provider first. But most generally, if your pregnancy is non-complicated, airlines will let you fly up to 36 weeks pregnant. It is recommended, though, that about halfway through your flight, or if it's a very long flight, every 2 hours to get up and walk the aisles just to get that blood flowing. When you are pregnant, you make a lot more blood supply, so we worry about things like blood clots. So getting up and walking the aisle every couple hours, which most pregnant women have to go to the bathroom anyway, getting up and walking back and forth, that can help with that. And making sure that you're staying well hydrated. Again, there's that water. Stay well hydrated. But again, I also would want you to check with your provider because you may have something going on with your pregnancy where we don't want you to travel. And then baby's movements. That's always a very big question. When am I going to feel my baby move? Most people will start feeling their baby move anywhere between 16 and early 20-ish, in the early 20s of your weeks, 20, 21 weeks. It usually starts feeling like a flutter or little bubbles. That's usually baby. But also it does depend on where your placenta is located. If you have a placenta in the front, sometimes it takes a little longer to feel that movement because it kind of provides a little cushion there. If you have a placenta that's behind the baby, you tend to feel movement a little bit sooner. But not uncommon if it's 20 weeks and you're coming to see us and you say, I haven't felt anything. I promise it's coming. It just might take a little bit longer. But that's a pretty big question. People want to feel that baby move. And then once we start talking about movement, once you hit 28 weeks in pregnancy, we want to make sure that your baby is moving at least 10 movements in 2 hours. So if you've been busy all day working and you're like, I don't know if I felt baby move that much today. Sit down, put your feet up, drink something cold or something sweet, put your hands on your belly. You should feel your baby move. And again, you want to feel 10 movements within 2 hours. That tells us that baby's doing well in there. Sleeping positions in pregnancy. A lot of people just want to sleep on their belly, on their back. That's fine at first. Once your belly starts getting bigger, around that 24-week mark, we really don't want you sleeping on your back. You have major vein artery that run behind that uterus, and when you lay flat, kind of hinders that blood flow. So it's better to sleep on a side. Either side is fine. If you don't want to sleep completely on your side, just tilted is good too. Don't worry if you wake up on your back. Your body will wake you up. Sometimes people will wake up feeling faint or feeling kind of sweaty. It's because your body's saying, wake up, I need that oxygen flow back. So again, you can sleep on your back or your stomach until we start getting a little bit bigger. And then questions about pets. Pets are fine. If you do have cats, it is recommended that you let somebody else clean that litter box while you are pregnant. Cats can carry toxoplasmosis, which can cause complications in pregnancy. And then next page is talking about alcohol and smoking. No alcohol or smoking. That's all we have to do. That's all we have to talk about there. And then page 11 is about when to call your doctor. So again, that's that phone number I was talking about earlier that's going to get in touch with someone 24 hours a day. It kind of will go over some questions and concerns that people may have, like, do I need to call now? Is this something I can wait for? Talks about bleeding, cramping, vomiting, things like that. So it's kind of a little directory there. But when in doubt, if you're not sure, just call us. We're available. So page 12 is going to talk about preparing for labor and delivery. So that's kind of talking to you about, options for labor and delivery. There's inductions. The earliest we can do an induction for you is 39 weeks, unless it's medically indicated, unless it's better for baby to be on the outside or it's better for mom to not be pregnant anymore. And that could be things like diabetes, high blood pressure. But if everything is going well with the pregnancy and there's no complications, the earliest that we could deliver you is 39 weeks. So that kind of is up to you at that point. Some people say, I am done at 39 weeks. Get this baby out. I am done. It works better for some people to schedule. There's not a wrong or a right. It's whatever works best for you. But it's just good to keep in mind that 39 weeks is the earliest that we can do it. And if you are pregnant past 40 weeks, we are going to add that monitoring on just so we can check baby's well-being, make sure that placenta is working well. And then when you do go into labor, you have the option of medicated or non-medicated. Epidurals, those are safe. They're done all the time in the hospital. They're not without risk. Anything that we do in the hospital has a risk. Sticking you for an IV has a risk. You have risk for infection, things like that. There's also other options besides an epidural if you don't want to do that. Again, nitrous oxide at Baylor, laughing gas, that can help with the contractions. It's not going to take away the pain, but it can distract you. It's like when you go to the dentist and have laughing gas. It can just kind of help you through it. IV pain medicine is an option. That can make you sleepy. It can make baby sleepy. We don't like to give it to you after 6 centimeters so that baby is not super sleepy when they come out. It gives them time to kind of work it out of their system if we don't give it to you past 6 centimeters. Baylor also has great showers, so water therapy, that is something that can help as well. Baylor also has wireless monitoring, so if you want to get up, walk around, we can still monitor your baby, but you don't have to be stuck to a monitor, which is nice. And then there's also the option for cord blood banking, which we have pamphlets here that we can give you. It's not something that's required. It's something if you want to do it, you can look into it. There are companies out there that do stem cell cord blood banking. They all have different prices. They all have different options. It's something you can look into. But if it's something you decide to do, please let us know so we're prepared. And they will send you the box and you will bring it with you to the hospital and we would collect that for you. And then that third party would come get it and it would be mailed off. There is different birthing classes that you can take. Baylor has options there, different childbirth education classes, CPR classes, things like that. They also, you can bring your car seat with you up to the hospital at delivery and they will make sure that it's working well and baby is strapped in well. There are some fire departments, not all of them, you'd have to check, but some fire departments that you can bring your car seat there and they will make sure it is installed properly. Circumcision. So if you are wanting a newborn male circumcision, that is something that our office can do for you. We do it in the hospital only. And we usually do it on day 1 of life or day 2 of life. That is optional as well. The thing with the newborn male circumcision is we require that baby have the vitamin K injection. Babies don't have that clotting factor when they're first born. It takes a couple weeks for them to build that up, so babies can bleed easy. It only takes 15 milliliters of blood for a baby to have a significant blood loss. That's not very much. So if we're doing a male circumcision, we're removing some skin, they can have some bleeding. So we will not do that circumcision unless they have that vitamin K on board. And again, that's something that we only do in the hospital. So if it's something that you want to do later, maybe a week or 2 after baby's born, that's something that you would have to figure out with like a urologist or a pediatrician that's not in our office. Okay, and then labor and delivery itself. How do I know I'm in labor? We have a little page on page 13 that kind of talks about true labor and false labor. So once we get closer to delivery, 36 weeks and on, it's not abnormal for our body to start having some cramping, having some contractions that come and go. It takes weeks for your body to prepare itself to have a baby. So cramping, contractions that are kind of there, here and there, totally normal. When we worry that, is this labor? Those contractions stay consistent and become more painful. I hate to break it to you, but labor is painful. It's gonna get more painful. So if you're just having some contractions, some cramping that is kind of there, it's been there for an hour or 2, but it's not getting more painful, and you put your feet up and rest, it goes away. It's just that your uterus is getting ready to have a baby. Now, if you notice, hey, this pain's getting more painful, more consistent, that's a pretty good sign that maybe something's going on. You should come to the hospital and get checked out. And again, you can always call us if you're unsure and talk to either the nurse or whoever's on call, and they will advise you of what to do there. If your water breaks, we want you to go to the hospital. Whether you're having contractions or not, if that water breaks, we're going to have a baby one way or another. So a lot of times once your water breaks, those contractions might start shortly after. But we want to get you to the hospital, get you on the monitors, make sure everything's going well there. Let's see. Let's talk about C-sections. So that's important too with midwives and OBs. Midwives cannot do C-sections, but say we're laboring, everything's going well, but now it has to turn into a C-section because our cervix isn't dilating anymore, or our baby is not loving labor and needs to come out. You're not going to lose your midwife. We have been trained to assist in C-sections. So we would be there with one of our doctors here in practice to assist with C-sections. And for our OB patients, we also assist our OB patients with their patients in C-sections. So that's kind of nice. You don't have to lose your provider there. If it is a scheduled C-section, again, you will have one of the midwives and your OB provider as well. Postpartum. With postpartum visits, if you have a C-section, we plan to see you 2 weeks after to do an incision check to make sure that incision is healing well, we don't see any signs of infection. And then 6 weeks postpartum visit to check in on you. Again, check if it's a C-section, your incision, talk about birth control options, check on you with how you're doing anxiety, depression-wise, and how breastfeeding's going. If it is a vaginal delivery, we just plan to see you at that 6-week mark, again, to check to make sure you're healing well, and if you have any questions, talk about birth control as well. So that is this OB educational class. If there was anything that you felt that you still have questions about or anything that I didn't cover, please make a list of questions you may have, and when you come see us for your visit, we are very happy to go over those questions for you. Or there may have been some things that I talked about, but you kind of want a little bit more explanation. That's what we're here for. Just ask us, please. And like I tell my patients every visit, when you go home, write down those questions. That's when you come see me, after we go through all of the important stuff of listening to the baby and getting your blood pressure, my first question to you is, what questions do you have for me? So we can go through all of those things, because there will be questions, a lot of them, and that's what we're here for.